what you want to hear and think about to how to improve your quality of life for those of you that have had acoustic neuromas, whether surgical or observation or radiation. It helps us, kind of steer the group to something that's really beneficial to you. I've known Rekha for several years now, and it's interesting. So she sent me her bio, but I got to tell you, as I look through this, it's amazing all the different roles she's played. She's been in the Division of Hematology and Oncology, Department of Neurology, University of Cincinnati Integrative Medicine Center, University of Cincinnati Brain Tumor Center. And I think one of the things that was really neat, so she's got she was featured in an internationally acclaimed documentary, Plant Pure Nation. And whenever I hear her, I always swear I'm going to do a better job with my diet. Her talk at the ANA meeting that was hosted in Cincinnati last year, I thought it really brought the house down. And Rekha kept on teasing me because she said, I promise you'll be in under 30 minutes. So Rekha, tonight you can keep the talk as long as you'd like. But I think that when she and I talked about this, her experience with malignant brain tumors is very different. But at the same time, what I struggle with is we as a nation, me included, we struggle with how we eat and how it affects us mentally, emotionally. If someone's undergoing surgery for an acoustic neuroma and they're morbidly obese, it's going to make the surgery harder on them. And so I think her talk, while she's got a lot of background as it relates to what she's done with malignant tumors, has a lot of words of wisdom. So thank you so much, Rekha, for sharing your time this evening with us. Appreciate you being here.
Thank you for those kind words, Dr. Sammy. And I am going to try to share my screen here. If you give me just a minute. And now I think I can share a specific thing on my screen. Is that correct? I think I can do that.
Yeah. If you want to do your PowerPoint, you can share the PowerPoint.
Oh, yeah, there it is. I got it. Yeah. Okay, good. Okay, can everybody see that? Yes. Is that good? Okay, great. I'm going to close this over here, make this smaller, so that way I can see it. Okay, so I can't see myself, so I hope you can. I hope you can see me. I wanted to start out this talk by talking a little bit. The title of my talk is. Hold on 1 minute. Make sure I can go back and forth. The science of wellness. And I want to talk a little bit about acoustic neuromas as compared to malignant brain tumors. As Dr. Sammy said, my world is really in the malignant brain tumor hematology oncology world, where I treat malignant brain tumors as like glioblastoma, as well as melanoma and other skin cancers. So what is really the definition of a tumor? So the definition of a tumor is too many cells and abnormal cells. So really, although acoustic neuromas are often called benign tumors or benign lesions, they fit kind of half the definition. So there's too many cells there, and that shouldn't be there. But they're definitely not the malignant brain tumor that we think of. But as Dr. Sammy said, we all need to be better at this and controlling our cancer risk in general. So that's what this talk is really going to focus on today. So how did I come about this? So when I was practicing in Toledo, Ohio, I practiced there for 6 years, my in-laws live. I actually was one of those doctors that would say, eat whatever you want, eat ice cream, you have a tumor, just do what you want right now. And I was treating lung cancer. So lung cancer are older men who have a smoking history, and they weren't me. So I didn't have a lot of anxiety about it. Then I started treating brain tumors when I moved to Cincinnati in 2009. And all of a sudden I was treating a tumor that had no etiology, no known source. And I started to get really anxious because I had all these patients, were young, healthy patients, and all of a sudden had a brain tumor. Like many of acoustic neuromas, you're just going about your life. We don't know the etiology of it, and they have a tumor. So I started to get really anxious. My husband said, like, you got to get away from this field and, you know, do all these things. And so I actually saw a movie called Forks Over Knives. Now, I don't know how many of you out there have seen Forks Over Knives. If you haven't seen it, it's a great, great movie. And it kind of changed my life because in that movie, they said that diet is closely linked to cancer. And I was like, wait a minute. I've been to medical school, residency, fellowship. I've never heard of such a thing, and this can't be true. But when I started researching it, I really found out that it was true. And that's how I kind of got into this world of integrative oncology. So integrative oncology is a field that integrates traditional medicine and as well as holistic medicine, or what you want to say, non-traditional medicine. So I'm an oncologist. I believe in surgery. I believe in chemotherapy. I give it all the day. I believe in immunotherapy. I believe in radiation therapy. And so therefore, integrative oncology is a field that I believe in. I believe that we can integrate both approaches. It used to be called complementary or alternative medicine, and we no longer use that term. But I want to ask you a question. How many of you guys, I'm sorry, I'm trying to move ahead, have heard of integrative cardiology? Nobody has heard of integrative cardiology. Why has nobody heard of integrative cardiology? Because the cardiologists have done a good job. Everybody knows that if you eat right and you exercise and you decrease your stress, your risk of cardiovascular events is much lower. Nobody talks about the integrative care of the diabetic patient. Why? Because we know if you eat better, exercise, manage your stress, what happens? Your diabetes is controlled. Now, why don't we have integrative oncology? We as oncologists are behind the times. We are really behind the times because it's not intuitive to put diet and cancer together. So hopefully at the end of this talk today, you'll see that it is actually intuitive and there's a very close link, okay? So why incorporate integrative oncology into your life? Well, it'll make you feel better. Everybody says, you know, diet, if you exercise, you'll feel better. But that's not the purpose of this talk today. The purpose of this talk today is to show you that it works. It works on decreasing cancer occurrence, incidence, and recurrence. And I hope you'll believe that with me at the end of the day today. So what are some of the issues with integrating integrative oncology into traditional oncology? Well, there's a lack of funding compared to pharmaceutical funding. Billions and billions of dollars are spent on pharmaceutical funding. I am trying to get a study approved for meditation and tumors, and I can't get it approved. I just can't. I'm asking for $10,000. I can't get it approved. Non-acceptance and fear from physicians. I was not in medical school, residency, fellowship, never had a nutrition course. And every physician has this fear that their patient is going to leave a curative treatment and go off and try a crazy diet, okay? There's a lot of fear from physicians. The interventions are often subjective. So what's stressful for me is not stressful for my husband. My husband is a good golfer. He loves golf. That's his stress reduction. For me, that's a very stressful event, okay? So the interventions are subjective, and there's a lack of large standardized trials. So there's not huge thousands of patient trials. So today we're going to talk about three aspects of integrative oncology. We're going to talk about stress, exercise, and mainly focus on diet. I'm going to talk about stress and exercise briefly, okay? So stress. So we'll never know if stress causes cancer. We can't figure that out because, you know, it would be an impossible study to put somebody on a golf course and half the people on a golf course and half the people not, and then follow them out and see for 10 years and follow them out. But what about stress and cancer progression? So, it's not letting me advance. So they took these mice and they put them in these little crates. And this is a validated model for looking at stress in mice, okay? And you see these little mice, they can't get turned around, and that's very stressful for them. If anybody's had rodents, they know what that is, okay? And then they injected their bellies with breast or ovarian cancer cells. And as you can see here in the control arm, the mice that were not stressed out, the mice that were not stressed out, very little growth in their tumor cells. Now, these are CAT scan of the daily stressed out.
Aroma on.
Okay.
Excuse me? Okay. So the daily stressed out mice, as you can see here, have massive growth in their tumor. Massive, okay? And this experiment was repeated multiple times by multiple experimenters, lab scientists, and we know that cancer can cause, stress can cause cancer progression, excuse me. So what if we treat this cancer? What if we treat it? Well, excuse me, I'm distracted by this, all this people coming in. What if we treat the stress? Well, they did a group therapy session for 90 minutes weekly with half of the women with stage 4 breast cancer, and self-hypnosis was taught for pain control and managing side effects of chemotherapy. What they then found out was that if you were in the group therapy arm, it doubled your survival. So the group therapy arm lived on average 36 months, a mean of 36 months, and the control group was 18 months. Now let's think about that. Double the survival from group therapy. We don't have a drug in modern oncology, maybe other than Gleevec for chronic myelogenous leukemia, that doubles survival. And this was just group therapy or counseling, okay? So what's another thing you can do for stress reduction? And this is a big focus of mine now, is meditation. And it's a buzzword, but you know, there's lots of studies, and I'm just gonna pick one of them to show that meditation has an impact on stress. So they did a randomized control trial of teachers. They did a 4-month course twice a day for 15 minutes, and they had a control group that was waitlisted. So they didn't think they were part of the group, they thought they were just waiting for the treatment. And what they found was significant decreases in stress, depression, burnout. Significant decreases, just 15 minutes twice a day, okay? But you're saying, I'm a super busy person. I can barely make dinner. How long do I have to meditate? Do I really have to meditate 15 minutes twice daily? Well, they took 17 healthy medical clinic employees, and they put them through a 2-hour course on meditation. And then they asked them to meditate 5 days a week for 5 minutes, 10 minutes, and 15 minutes. And what they found is even the 5-minute group had lower stress, lower anxiety, and increases in overall wellness and self-assessment. So just 5 minutes a day can get these benefits to you. And again, remember, we're not talking about making you feel better. We're talking about decreasing cancer incidence, okay? So what about exercise in cancer? So exercise is also a benefit. This is a really interesting experiment, and it's close to my heart because I treat melanoma. They took mice again, and they put them in a wheel. Half the mice had a wheel, a cage with a wheel, excuse me, and half the mice did not have a wheel, and that was the control group. Then they injected them with melanoma cells, and I don't think you can see my pointer here, but if you look on these pictures of the cells, let me see if I can pull up a pointer actually. I think you can see that now, maybe, right? So if you look at the pointer, can you see the pointer? Okay. So if you look at the control group, this is the group with a lot of disease over here. That is the group that didn't have the wheel. The experimental group had the wheel and hardly has any melanoma growth, which is crazy. So then they were like, how did this happen? So what they did is they looked at natural killer cell activity. So this is an electron microscope picture of natural killer cells, and that's the real name. People always ask me, is that the scientific name? I said, yes, that's the scientific name. These are natural killer cells. These are T cells or immune cells that are the policemen of our body and should be floating around our body trying to attack cancer cells. This is a natural killer cell attacking a breast cancer cell. So what they did is they repeated the same experiment, and they removed the natural killer cells from the mice this time. This time it did not matter if you had a control, if you had a wheel in your cage or not. The cancer grew the same. So we know what exercise does is it increases your natural killer cell activity. You don't need to do 2 hours of exercise a day. You only need to do a few minutes. Do we have proof of that? Yes. This is an experiment looking at survival in lymphoma patients, so progression-free survival, the amount of time they stay without progression. And they had them exercise 3 times a week for 15 to 45 minutes, okay? So the exercise group had a 69% progression-free survival, and the control group had a 59% 5-year progression-free survival. So about a 10% benefit in progression-free survival. But then what they looked at, this is a very interesting graph. If you look at the black line at the bottom, that was the group that didn't exercise at all. The blue line at the top is a control group that crossed over to an exercise arm. The red line is an exercise with less than 80% adherence. And the green line is exercise with greater than 80% adherence. So even if you could not adhere to 15 minutes 3 times a week, you still had a benefit in terms of your lymphoma survival. That's crazy, right? 15 minutes 3 times a week. Any of us can do that. Any of us can do that. And I'm not talking about, you're not going to lose huge amounts of weight. I don't know about your cardiovascular survival. I don't know about your diabetes survival, but we're talking about cancer survival here. Okay. And now the reason you're really here, let's talk about diet. Okay. So unfortunately, most diet studies are what we call prospective cohort trials. That means you have a group of people that are exposed to, let's say, smoking, for instance, versus a group that is unexposed to smoking, for instance, and then you compare them and you compare their incidence of cancer. Now, this is a very biased way of looking at things because, for instance, smokers may have other cancer risk factors, for instance, obesity or alcohol, for instance. So it's hard to separate those confounding factors. So you need to do huge studies to really look at this. So the European Prospective Investigation in Cancer is one of the largest cohort studies, 23 countries, 10 countries, 23 centers in Europe. And it's a study of 500,000 people. This is what 500,000 people looks like. It's a huge study. 1991 protests of the communist government, 500,000 people, okay? Now, what did that study show? It showed many things, okay? It's been completed and they're coming out with data all the time. One of the most important things it showed was that processed meat is as dangerous as cigarette smoking. So if one of the first things you're gonna stop doing is I would stop eating processed meat as part of your diet. So that's that study. But what we really like in oncology is what is called randomized placebo-controlled clinical trials. We like this. We like to randomize you by a computer to drug A and drug B, okay? Randomly allocate you and then follow you out through time because we think this reduces that bias that I was talking about. But can you imagine doing that in real life with a diet? I'm gonna take half the room and randomize them to one diet and the other half to another diet. It's very, very difficult to do, very expensive. There's not a lot of funding. Well, there was one trial that did it. Oh, before I go on, I want to talk, if we're going to talk about these clinical trials, then we need to talk about how we look at the clinical trials. So this is a randomized controlled trial looking at surgery versus chemotherapy in lung cancer. And the surgery arm is on top. It's better, and we're looking really at the space between the curves, okay? So what we're looking at is the space between the curves right here, okay? And what we're also looking at is for a p-value of less than 0.05. I want you to remember this number because I'm gonna come back to it, and there's gonna be a quiz on it. I can't really quiz you because you're not, I would quiz you on it. 0.05 means, and this is put in layman's terms, that it didn't happen by just chance. So it's not like going to Vegas and it's a flip of a coin. The intervention really, really occurred, okay? So, can you guys all still hear me? Okay, great. So the JAMA, it was published in JAMA Internal Medicine. They were able to do a randomized double-blind, not blinded, but control study. So between October 2003 and June 2009, they took 7,447 participants. They randomized to a Mediterranean diet plus olive oil, a Mediterranean diet plus nuts, and a control diet. And what they found was that the Mediterranean diet plus olive oil decreased breast cancer incidence by 62%. Now let's stop and think about that for a minute. 62%. If I told you there was a pill out there that would decrease your breast cancer incidence by 62%, it would be on the front page of the Wall Street Journal. Everybody would be going out to get it. Remember that p-value I talked about? Very statistically significant, 0.02. So this is just changing your diet. Decreased by 62%. Oh, and by the way, it also decreased 30% decrease in heart attacks, stroke, or death. Again, very significant p-values. We're talking a p-value 0.009. So, you know, the Mediterranean diet is good for your cardiovascular risk. It's also good for your cancer risk. What is the Mediterranean diet? It's a whole food, plant-based diet. Basically, lots of whole grains, lots of fruit, lots of vegetables, very little fish, almost no red meat and sweets, okay? And we're gonna talk about that in a little more detail later on. Okay, so the randomized control data is very, very difficult to get. It's expensive, it's rare. The prospective cohort trial that I talked about is laden with bias. So how can we really look at these interventions? Well, there's two ways. One is to look at the biologic tissues underneath the microscope is one way. And a more important way, which I've already kind of shown you, is looking at mouse models and looking at animal models to really take out the bias, because mice don't have that innate bias against or for golf, okay? So it's a great way to look at it. Now, if you look at the left side of the screen, we in medicine are very focused on bodies as machines, okay? You know, my husband is a total joint surgeon, and he only does hips and knees, and he won't answer any questions about elbows or arms because that's another orthopedic surgeon. So even within the bone world, we are super specialized. I do melanoma. I won't answer any questions about breast cancer. But we have to stop looking at our body like that and understand that our body is like the ocean. It's like an ecosystem. You take out something from the stomach and it affects the arthritis in your hands. You take out something from the mouth and it affects your foot joint, okay? We are an ecosystem, like an ocean. So this is where the microbiome comes in. And the microbiome is a very popular discussion right now. And this is an interesting study, very, very interesting study. If you guys want to pull it up, it was published in Science in 2018. And they took patients with melanoma therapy. And then what they did is they gave them immunotherapy, which is turning on their immune system. It's a kind of chemotherapy, but it turns on your immune system. What they found, if you look down here at this graph, the blue line are the patients that had great alpha diversity, meaning their microbiome was very diverse. They had many, many different kinds of bacteria. And what they found from that is that those patients had a much, much higher progression-free survival as compared to the low microbiome. But that's been shown many times. It's not that exciting. What they then did was the exciting part. They took the stool from the humans and they fed it to germ-free mice. After that, they let it get colonized. They injected a melanoma cell into the mouse's rump. And then they gave the mouse the same type of immunotherapy. Now, if you look at this graph on the left lower side, you can see the red graph is the mice that received non-responder stool. So let me be clear. The humans who didn't respond to the immunotherapy, okay, their stool was labeled as non-responder and given to the mice. When they got the mice got those stool, the mice didn't respond. When the mice were fed responder stool, then they did respond, and depicted by the blue here. The only difference in the mice, they got the same type of melanoma. They were genetically identical mice. They were germ-free mice. They got the same therapy. The only difference was the stool that they ate from the human. So that's crazy. So what we know is that our microbiome, the gut, our bacteria, the bacteria in our gut is the quarterback of our immune system, okay? And a picture is worth 1,000 words. So I want to show you this. This is twins, identical twins. One was obese and one was very thin. They again took their stool, fed them to genetically identical germ-free mice. And as you can see here, the mouse that got the obese twin stool became obese, and the thin twin stool stayed slim. They were eating the same diet. They're this genetically identical mice, and they're germ-free mice. So that just shows how diseases can be transmitted through the microbiome. So bacterial diversity is everything. That is the most important part, okay, of our microbiome. And that is being totally diverse. That means you want all different kinds of bacteria. Okay. Now, you're saying to me, okay, Dr. Chaudhary, that's great. That's awesome that you think this. You've shown us some really interesting data, but I've been eating like this my whole life. How quickly can I change my microbiome? Well, a very interesting study by O'Keefe et al. At the University of Pittsburgh took 20 African Americans and then 20 rural South Africans in rural South Africa. And they switched their diets. The African Americans got a low-fat, high-fiber diet, and the South Africans got a high-fat, low-fiber diet. Now, they put them in a hospital for 2 weeks so they couldn't cheat, okay? And they did a colonoscopy on them before and after. And what they found, if you look over here in the circle that I just put there, the left side is the amount of proliferation or the amount of cell turnover in the African Americans before they started. Lots of proliferation, lots of inflammation. And after just 2 weeks of being on this diet, they have markedly decreased proliferation. Also, if you look at inflammation in the South Africans, very little. The brown is the inflammation. Very little inflammation, actually. And then if you look at them after 2 weeks of eating that high-fat diet, lots of inflammation. So just, we can really change our microbiome. We have 39 trillion bacteria in our body and only actually 10 trillion cells in our body. So we're mainly bacteria, and we can change those very, very quickly, okay? So, why do you go on a diet? You go on a diet to lose weight. You go on a diet for microbiome purposes that I've just talked to you. But can you change your cancer cells at a cellular level? This is an interesting study where they took ER/PR positive breast cancer patients. They gave half of them a flaxseed muffin and half of them a regular muffin after they underwent a biopsy. Then a few weeks later, 2 to 4 weeks later, they got their lumpectomy, which is their final surgery. What they found is greater apoptosis in the flaxseed muffin arm. This is an electron microscope picture of a cancer cell that's dying. And that's how cancer cells should be. They should die on their own. When they looked at the flaxseed muffin arm, on the left-hand side of the arrow is apoptosis index in the regular muffin. There's no change. P equals 1.00. There was no change. If you look at the p-value on the right side, p equals 0.007, excuse me, very statistically significant increase in programmed cell death in the cancer cells. Just as from eating a flaxseed muffin for 2 weeks. 2 weeks. I like to bring this study in because people always tell me, well, I can't change my diet now, but this is just 2 weeks of eating a flaxseed muffin. It's a very interesting study. So a lot of people talk to me and say, that's great. Again, okay, fine, I'll change my diet. But I'm just genetically predisposed to this. And we know that this is not true. So Japanese women that live in Japan have exquisitely low risks of breast cancer. When they come to the United States, however, they have very high risks of breast cancer. Their breast cancer risk goes up markedly, the same as American women. They're genetically the same. What happened? What's called epigenetics. So epigenetics is the expression of your genes. It doesn't change your genes, but it's the expression of your genes. So Elizabeth Blackburn won the Nobel Prize in Physiology and Medicine in 2009. I got the good fortune of meeting her. It was awesome. She's an amazing woman. She's only one of 12 women who have won the Nobel Prize in Physiology in Medicine throughout history. And she won it for her work with telomeres. So telomeres are the caps on our chromosomes. They are like the caps on our shoelaces, and they keep our chromosomes from unraveling, okay? Just like caps on our shoelaces do. They're associated with increased cancer risk, disease risk, and premature death. Okay, so Dean Ornish and Dr. Blackburn partnered together to look at 93 patients with low-risk prostate cancer. Patients were randomized to a control arm and an experimental lifestyle arm. The experimental arm had a plant-based diet, exercise, practice stress management, and attend group support sessions. What they found, this is the crazy thing, listen here. They found that their telomeres in the experimental arm, okay, so this is the blue blocks right here, got longer. Their telomeres actually got longer. They didn't age like normally, they got longer. The other arm, the control arm, they got shorter as appropriate, age appropriate. P-value 0.004. There's a huge difference in the telomere length. You can't fake your telomeres. This is at a genetic, epigenetic level. Okay, so how are you going to go about doing this? My recommendation in terms of telomere lengthening as well as microbiome diversity is a whole food plant-based diet. Now, lots of people get focused on the plant-based part. You know, they're just so focused on the plant-based, but Oreos are plant-based. So what I really want people to focus on is a whole food diet, eating things that look like when they came out of the ground, okay? So the first question I always get is, where do I get my protein? Where do I get my protein if I'm only eating plants, okay? This is a great question. And if I had a dime for every time, I'd be a rich woman. There's an interesting study done in Loma Linda, California, on the Seventh-day Adventists, because many of them are vegetarians as part of their religion. And what they looked at is how much protein they were getting in a day. Now, the World Health Organization recommends that we get at least 40 grams of protein in a normal, non-breastfeeding woman, okay? And what they found was that the meat eaters got about 80 grams of protein, but even the strictest vegetarian got about 70 grams of protein. We are not protein deficient in this country. We do not need more protein, okay? Protein deficiency is not a problem with us. And if you don't believe me, I would encourage you to see a great movie. It's called Game Changers. It's on Netflix. It's produced by Arnold Schwarzenegger and Jackie Chan. And it shows the Titans football team is one that's featured there. Their majority of the team is now plant-based, and this is a bodybuilder who is also featured in the movie and is on a plant-based diet. So lack of protein is not a problem. But now you're thinking, wait a minute, what can I eat? Well, there's a lot you can eat. So if you go to UDF, you can get most of these foods. Almonds, cherry tomatoes with salt is one of my favorite snacks. Olives, carrots with hummus, snap peas with hummus, carrots with spicy guacamole, chia seed and water. That's a weird one. That I like that one, but not everybody likes that one. Chia seed pudding is another one. Pumpkin seeds, sunflower seeds, spicy peanuts, green pepper with garlic expressions dressing is what I like. What can you do if you want to go fast food? I love fast food. So Chipotle, you can get the veggie burrito bowl with beans, brown rice, and guacamole. The Taco Bell, you can get you know what? They no longer have the 7-layer bean burrito. This is not up to date. They removed the 7-layer bean burrito last month. But the 7-layer bean burrito, when they had it, minus the cheese, rice, and sour cream. Burger King has a veggie burger that you can crumble on the salad, and the list goes on and on. Lots of places, if you go to Carlo and Johnny's, they have a vegan menu. You just have to ask them, and the chef is often very, very happy to make something plant-based and whole food. So I made this slide myself from all different kinds of books that are New York Times best-selling books. So everybody's very confused about what to do. There's keto, there's wheat belly, there's forks over knives, there's paleo, there's all kinds of diet. I suggest reading this book if you haven't read it. I just read it. I just finished it maybe 2 or 3 weeks ago. It's called Fiber Fueled by Dr. Bill Wolskowitz, and he is a gastroenterologist that trained in the Georgetown area. He's also a statistician, and he is very interested in the microbiome, and it's a great, great book, and it talks about the diversity of plants that we need, and it's really, really a great book. I recommend it to everybody. So what should you do? eat real food, mostly plants, not so much, okay? But my prescription is try a completely whole food, high fiber, plant-based diet for 1 month. So my husband went out to dinner with Colin Campbell, who's a mentor of mine, and we were out to dinner, and Colin Campbell told my husband, and my husband was kind of against this. He's kind of a meat and potatoes kind of man. He said, just try it. Try it for a couple of weeks. My husband's a surgeon, so he's having some back pain, and he tried it, and his back pain went away after a couple of weeks. So I really think you try it for 1 month, okay? It takes 1 month to really kind of see some of the effects and see how you feel. I'm gonna leave you with the final study. 10,000 people took the MMPI, which is the Minnesota Multiphasic Personality Index. I took it in medical school. And then 18 years later, 534 of those patients developed lung cancer. The patients were divided into the optimistic group and the pessimistic group. And it's very interesting that the authors on this study they didn't call them optimists and pessimists, they called them the non-pessimists and the pessimists. So they must have been pessimists themselves. But what they found that optimism improves lung cancer survival by 6 months. Look at the p-value down here, 0.015. Oh, by the way, carboplatin and Alimta, which is our chemotherapy for lung cancer, improves median survival by 3.4 months versus placebo and costs $17,000. Optimism is free, okay? So I got to see Oprah live. This is me with Oprah. It was amazing. She's amazing. And one of the things that I talked, when I started out this talk, I was talking about my fear. I really went into this because I was so scared and so anxious. Oprah said that the opposite of love is not hate, but it's actually fear. And we do things. Why do we yell at our kids? We yell at our kids because we're scared, right? They're going to do something. We yell at people or get angry with people out of fear most of the time. So I implore you that if you're going to try this lifestyle change, then please, please do it in a way that is not fear-driven, and do it in a way to live a spa-like lifestyle, to be in a world of wellness and be in a world that is what is the best for you and your future, for your mind, body, and spirit. So my recommendations are eat food, not too much, mostly plants, practice gratitude, meditate every day, sweat once a day, and remember my prescription for you really is to, if you really want to try it and be all in, is to do it for 1 month straight. Thank you very much. And I think that's the end.